Half of what we do is forensic psychiatry. That means, forensic means where law and medicine meet. So we're interested in state of mind of someone who's ended up in the criminal justice system at the time of their offense, or their fitness to stand trial, and perhaps they might be found not criminally responsible due to mental disorder. So that's about half of what we do. The other half is we're just a tertiary care psychiatric hospital, so we do geriatric programs, we have a dual diagnosis program, a drug and addiction program, we have a long-term program for patients who are in the system for quite some time.
I was messed up, and then I'd just be imagining what could go wrong next and stuff, and then it's sort of like self-fulfilling prophecy type thing, like make it happen and that. But the Army thing, like it was like nobody ever did a more horrible stint than I did, and unless they were a prisoner of war or something like that, right? It's how I got involved with mental health in the first place. But up here, to be admitted to Penetanguishene, I did a terrible crime. I can't really describe it. I really can't.
The diagnoses here range the whole gamut, but mostly a serious mental illness. For example, if you have a phobia, that's quite treatable, and there would be no reason to come to a psychiatric hospital for phobia. We could do that in the community, right? And that would make more sense. So most of our folks have some of the what we call the more serious illnesses, things like schizophrenia, bipolar disorder, which we used to call manic depression. So we have bipolar, schizophrenia, some acquired brain injury, some significant cognitive impairments called developmental delay. We sometimes lump those under. We have some folks with some pretty severe addiction problems and also a mental illness, those kind of things. So we have a broad range of diagnoses, but most of the stuff because we're an inpatient operation, mostly the stuff that's going to have a pretty severe impact on the lives of those folks. And depression, that's one I didn't mention, is another big illness that we get here, severe depression, right? So when we look at treating someone, we look at their whole history. An experience in war may or may not be a significant contribution to their illness, but it's certainly something we would look at and investigate.
I have a military pension, so I'm able to buy my own sporting equipment for the very best of whatever I want to use. And, I've learned two things really good here. One is throwing the football, and then I've started playing the guitar, and everybody's probably motivated by kindness more than anything, but they say I'm not too bad at the guitar. Always wanted to play the guitar, and I thought I was going to have a long time to practice, and that's
I meet the patients every day and talk to them about a variety of things, and yeah, I find them very interesting. They're like you and I. They have hopes and desires. They have a lot of talents, very artistic talents. They have interests, so they're interesting people. Now, they also have, most of our patients here have a serious mental illness, meaning that they've got a diagnosis, some kind of disability, and it's lasting for some duration, what we call the 3Ds. So they're very interesting people. They're a lot like you and I, but they also have a serious mental illness. It's rewarding to work with them and talk to them.
I got out 94. I was in Oak Ridge, and I was in the mental health center for, altogether, I was in the both of them for about 17 years of my life. So I was glad to get out on the street again. Once you leave the hospital, it's all different. You gotta, the rent and the all that food and all this was all different when I got out.
As an administered hospital, we have what we call a psychosocial rehabilitation approach to mental illness, meaning it's kind of a philosophy of care that we try to impose in it, and that gives us the best kind of result.
For the most part, they're pretty damn good. They really are. But I mean, like, like by definition, you're a mental patient, so you're going to do something crazy, you're going to be motivated to do stuff that's not right, as far as they see it. I think they see the role in So basically, you know, a lot of them think that, you know, their role is, you know, is to stop us from doing what we want to do, because, you know, if we do what we want to do, it'll be wrong. It'll be a mental thing, you know, doing the wrong thing or something. So
it was tough, you know. You have to do what they tell you. You can't do what you want.
Do a lot of program evaluation to find out if we're being effective. We do research here. We're obligated to do research when we make changes or we offer therapy to folks. It's important to do research and see if you're actually having an effect, a positive effect, and so on. So, but a lot of making sure that we're as professional as possible has to do with again, the colleges and the things we have to do as a hospital to make sure that we're professional. And the approach to mental health changes. It's different as we learn more, and as the eras pass. We get, for example, the development of new medications, which can be very helpful, and we develop some new approaches to group therapy too. So the two of those two are important. But in order to make sure that everyone does that in an ethical and scientifically sound way, we have to have a proper philosophy. We have a research and ethics committee to make sure that people are behaving in an ethical manner and so on. So there's lots of checks and balances to make sure that our staff and our programs are the best possible they can be, and that they're also ethical and moral and operational.
I got it all pretty good with them. I did what they want just to get out of there. If I have to, you know, kiss ass, another word for it. If you want to get out, you got to do what they say.
they've got me on good meds. I wouldn't be here if I had been on the right meds before in life, you know. But I mean, on meds, if you have to rely on being able to hold a job and function, you know, have a good occupation or something like that. It's not available to mental patients. It just isn't. Now, with the medications improved or whatever, there may be a chance that mental patients can transcend this thing and actually learn to work.
I had to take pills for my nerves. I take an antidepressant nerve pill. I get angry very, very easy. If I wasn't taking this pill right now, I would probably hurt somebody. So that's why they put me on an antidepressant pill for my nerves.
I do see a lot of changes in a variety of patients when they come here. I consider myself privileged to get to know some of them, and I see them sort of progress through their time here. And like all of us, as we travel through life, they grow, they get better, they get happier, they have their ups and downs. And but it's very, very rewarding when you see a patient who's not doing very well, and after they've been here for a little while, starts to sort of get things together. We maybe get the meds right, or they get some really good group therapy, and then they tell you excitedly, you know what, I'm going back. I'm going to get my old apartment back. I'm going to go back to my old job, and they go back and reintegrate, and that's the most rewarding thing that can happen to you when you're working around here.
If I hadn't been hospitalized here, I imagine I'd probably jumped off some bridge or something. My mental and emotional comfort has increased dramatically. And that's been because in a place like this, you know, you're forced to face all your demons and everything like that, right? And if you do, you get better.
My saying, if you do what you have to do out in the community to stay out here, take your medication, don't cause any trouble, and just be yourself.
But that means we want them to be as happy and the best that they can be, and there's a lot of things that it takes there. First of all, we'd like to see them, find some joy in life, find some reason. All of our patients would like to work, make a contribution. Like all of us, they'd like to have friends and family, so we want to see them maximize their quality of life. the best they possibly can be with their deficits. Part of that that's important is seeing the community understand mental illness and the mentally ill and being accepting them and let them reach that potential.
It's obvious here that we're sick, you know, and we're trying to get better and do stuff, but time's going to go by. You know, you got to sort of, best thing you do is make sure you got something to show for it.
People tend to overemphasize the connection between aggressive behavior and mental illness. The reality is that the link between the two is pretty slim. So you should not fear people who have mental illness. You should fear aggressive people. You should look at people as individuals. We tend to overemphasize that connection between violence or aggression and mental illness. It's a fairly weak connection, if it's there at all. Look at each person as an individual and to be just and fair to them.
I know my way around that, so I don't have any problems at all. I just mind my own business. Somebody tease you, say you're, you know, a sick person, or ask you, did you come out of the mental health center? And I tell them, hey, you do what you want to do. You just tell them to shut their mouth.
But I just told myself, if I can just get through this with honor or whatever, then I can use the rest of my life to, if I had that core achievement, I could build on it and then maybe discover mental health again.
I go to Wendet Social Club, our place, just across from outpatients and that. And I go down to the dock. I ride my bike. I do a lot of walking. That's how I keep fit. That's why people don't believe my age. So I have to stay out of trouble, mind my business, and do what my worker says.
A few years ago, there was a really severe stigma around being mentally ill or being a patient at a psychiatric hospital. We haven't quite erased that stigma yet. We've made a lot of progress, but we still need to we need society in general to understand mental illness better and the mentally ill better.
I'm hoping to show that a person really can change and can move on and stuff like that. If I can do that, I'll have accomplished something.
If you are in need of mental health care, it's always wise to seek it out. Or if you have a friend or a loved one or a family member that needs mental health care, don't be shy about recommending they do that and having them seek it out. Sometimes we have so much great respect for each other's privacy that we leave people alone. They may be very depressed, maybe suicidal. It's worth at least asking and intervening. So I think it's always better to seek treatment and seek treatment early if you truly do have a mental health issue. Some people do avoid the hospital again because of that stigma, and sometimes the result is that the recovery is more difficult because they've waited longer and there's more disruption to their lives.